All right, thank you, Dan. Our 7 News medical expert, Dr. Cedrek McFadden, is with us this afternoon. We're going to talk about a strange new syndrome that's popping up more and more in children and how it relates to COVID-19. So what is this that we're talking about? Because we've heard about especially cases in New York.
Yes, so we're talking about the pediatric multisystem inflammatory syndrome seen primarily in children. Now, we know from the beginning that the coronavirus has largely spared children. The CDC reported in April that only 1.7% of 150,000 cases were actually seen in children. But doctors are finding a new syndrome that some children are becoming seriously ill with symptoms of inflammation of the skin, the eyes, the blood vessels, and the heart. Now, this is occurring weeks to days after an infection with COVID-19. At this time, we can't say for certain that COVID is causing these symptoms, but there is some temporal relationship where these vessels are getting attacked or there's an over-exaggerated immune response.
And so are children at increased risk for this in terms of their exposure to the virus? So if they're exposed to the virus, there is a chance. Do we know what the chances are of them having this develop?
So we have very little data around this finding now. In some cases, even the adults, up to half or 50% of people that have COVID-19 don't even have symptoms. So we're not certain whether or not these children were infected at the time of diagnosis or at the time they're having these symptoms. Many of these children will either test positive for coronavirus or test positive for the antibodies for COVID-19.
How common is this when it comes to children getting coronavirus, period?
So again, they're presenting as only 1.7% of those cases.
So pretty small.
Pretty small, 1.7% of 150,000 that the CDC actually sampled. But we recognize that it's seen in both infants up to teenagers. There may be some more of a prevalence in the older children, and some reports talked about boys maybe at slightly higher risk as well.
So do we know those kids that have developed this syndrome later, were they asymptomatic COVID patients? In other words, did we even know they had COVID back when they had it, or is this something they discover after they come up with this new symptom?
I think it's a little bit of both.
Okay.
It's a little bit of both. The real key finding in all this is just to be aware that this is even a possibility.
So what do parents need to know?
So parents need to look for the signs and the symptoms. So the signs and the symptoms primarily being fever, a rash. They can have skin color changes. There also can be redness or sort of a bloodshot eyes. They can have abdominal, GI complaints as well. It can lead to heart failure. It can lead to dysfunction of the heart muscle. And in very severe cases, it can lead to that heart not being able to pump oxygen, important blood all over the body where it needs to be.
And we've seen deaths in children with this.
You've seen a few deaths. Fortunately, this is still rare, and fortunately, most cases are mild. But you know, for the children that do require hospitalization or help with the mechanical ventilation, it can be a little bit more serious.
And what are they doing to treat this for these children?
They're getting treatment with steroids, intravenous immunoglobulin. They're also getting treatment in some cases with antibiotics and oxygen. More severe cases may need blood pressure support and other things to be helpful for the whole body.
So this is definitely not completely tied to COVID yet. They're trying to figure that out. It's an investigation, so to speak.
There's a temporal relationship. There's a temporal relationship of these children that were tested positive or now have symptoms and then show that they have antibodies. So there is some relationship there, but we cannot say at this time it's caused by, but fortunately it's rare, but we all have to be paying attention.
Have they sent out a warning about this yet, like a federal warning?
So we're expecting the CDC to release a statement to doctors saying, be on the lookout for this, because we don't want parents ignoring this, saying, well, it's just a stomach virus, it's just the bug. You know, we really need to have this at the front of our differential diagnosis, is what doctors use all the time to help us determine, well, what things could this be? This needs to be on that list. We need to be looking for this to make sure we're treating these children to keep these mild cases mild.
Dr. Cedrek McFadden will be with us taking your questions coming up live at 5, and we appreciate you putting this on the radar for us. Thank you, sir.
Thank you.
And you're watching Carolina's Family at 4. We're coming right back.